This is from Minister Dix for a colleague. We're seeing rates of burnout from paramedics that are incredibly high. We've heard from one that said that 10 to 30 ambulances are down on a given night because of that burnout. What are you doing to address those concerns, and what do you say to British Columbians who may be underserved by paramedics because of the burnout that's happening from workers?
Can I say a word first, just to put a shout out to my colleagues who work in the VC Emergency Medical Services and our ambulance paramedics everywhere in this province, the community paramedicine program. It has been an incredibly challenging time for paramedics and for all first responders, with both of the public health emergencies that we're dealing with. And I know it takes a toll on us physically, but also mentally and emotionally as well.
Richard, I think the work, as Dr. Henry has just said, of our ambulance paramedics has been truly extraordinary. In this time, we have 2 public health emergencies, as you know, on the ground for people in every region of the province for our ambulance paramedics. The impact of the overdose public health emergency has been significant and is a significant daily part of the lives of ambulance paramedics everywhere. And it has an impact even beyond the numbers of calls. We're not seeing an increase in general in the number of calls, but the overdose crisis has made a major qualitative difference in the lives of ambulance paramedics. As you know, we have added significant ambulance paramedics positions in the last 2 years across the province of British Columbia, including very significant additions in rural and remote areas during this pandemic to address the challenges of COVID-19 and the need often to get people to regional hospital centres more quickly. The significant number in the intervention of ambulance paramedics, for example, in communities such as Fort St. James, in the Cariboo and other regions, has been a sign of this, and we're obviously very concerned about that work, and we're working very actively with the Ambulance Paramedics Union, QP Local 873, the Ambulance Paramedics of BC, to ensure that we're addressing quality of life issues amongst ambulance paramedics. I believe I'll be meeting in the very near future with the President of the Union to discuss those ongoing issues. I think I would say that together with our ambulance paramedics, we were able to together negotiate a collective agreement, freely bargain at the bargaining table, which was an enormous achievement. And we've significantly increased the number of both ambulances, access to air ambulance, and the number of ambulance paramedics in BC, and expand the community paramedicine program. All those things we've been able to do. But the daily reality of life that you talk about in your question is real, and one that we're working with our ambulance paramedics to address, to assist, and to provide the kind of support necessary both to help people deal with the incredible stress of the job, but also to help people recover who've needed to take time away.